Friends, I'm your digital osteopath, and I have made some claims in previous videos about the TMJ. So it's only reasonable and fair that I actually talk about the TMJ, since it's also a very underspoken about topic, and it's a nightmare to look into it because you have to look through hundreds of resources just to find that one little thing that nobody ever spoke about, which was there the whole time, and then you have to keep doing that again and again. So, let's get into it. I'm going to split this into 4 parts. First, starting on the anatomy today. Then we're going to look at the role and function and the pathologies and also maybe some management as well at the end. But as you saw in the disclaimer, I am a student. I don't know everything. Some of the things I'm saying will be wrong, no doubt. But I will do my best, and I have done my best to make sure everything is correct. So there's a little thing there. When we do the anatomy today, it's going to be very much me telling you what's there because it's quite hard to teach anatomy. It's more something you have to learn yourself. But where do you start? Which is the reason why I've gone with the anatomy here. So let's start with the bones. What do we have here? I've changed my cursor to make it nice and visible. The mandible, that is your main jawbone, the one that everyone thinks about when you think about the jaw. We have here the mastoid process as well, just behind your ear. And there's a styloid process you're going to see in a second here as well. And also those bones of the head and face. I believe this is the temporal bone, frontal bone, zygomatic arch / bone, and maxilla. And don't forget your teeth. What you're going to learn by the end of this, if I can't change that, is it always comes back to the teeth. Next slide. The neck. The TMJ, the jaw, and the neck are inseparable. Okay? Here we have the hyoid bone, fluting bone, also not really talked about enough. And there's that styloid process I was talking about. Moving on to ligaments next. There is a capsule around the jaw. We'll talk about that a lot in pathology. And this temporal or temporary ligament, as they've called it here, on the front. And look at the direction they're running. What does that tell you about the forces going through the TMJ and where it might be susceptible? However, on the inside, you've got these countering ligaments going in opposite directions. Stylomandibular coming from that styloid process, and the sphenomandibular coming from the sphenoid bone, just at the base of the skull. The butterfly bone, as they call it. And also, really importantly, there's a disc, which I'm so happy there is, inside the jaw. Just to get your bearings around this here, we're zooming in on just this articulation between the jawbone here and the eminence. So as you close the mouth, it rests here, and you can see how it's got these attachments over here, so it can be pulled across when you're opening that jaw. And we'll talk a bit about how the jaw moves as well later. Now this is cool. The lateral pterygoid muscle attaches to the articular disc. But before that, there are 3 main muscles that people talk about when they talk about the TMJ. There should be more, but these are the 3 main ones. You have your temporalis muscle, this big one right here. There's masseter muscle here, strongest muscle in the body. And the pterygoid muscles, I should have said 4. Lateral and medial, which we'll see in a second. It does attach on the articular disc. So as you're contracting that lateral pterygoid muscle this way, think about what that does to the disc, pulling it over. As you're opening your mouth, it pulls it over, which is a really important articulation there. And these main muscles here are what close your jaw, essentially. What help you chew, what close your jaw. You don't really need any for opening because you can just relax those muscles to let your jaw open down with gravity. Here's a picture of the pterygoid muscles again. Everyone talks about them, no one knows their attachments. Here they are. So they're quite involved as well in lateral deviation, whereas the other main muscles are more, you can see the direction of them there, involved in closing that jaw and putting force through it. There's the medial pterygoid behind there posteriorly on the internal aspect, whereas lateral is external. What did I say about the neck? Inseparable. Hyoid bone. TMJ. Let's get our bearings around. These facial muscles, they're missing some of the ones that really articulate and are associated with the jaw, that zygomaticus major. We have these strap muscles down here, the suprahyoid muscles. This right here is the digastric. this long one here that then thickens over here. Digastric, 2 belly, 1 belly here, 1 belly here, and there's that little tendon in the middle there. This is probably the one people talk about the most in terms of opening the jaw, but like I said, that's just an accessory movement. It doesn't really necessarily need it as much. Neck muscles, got that splenius capitis, levator scapulae, all those main ones, they all work in conjunction. Think about the suboccipitals as well in that head posture and what that does to the jaw. So just to have a look at those strap muscles and the suprahyoid muscles there a bit deeper. Remember the mnemonic, toss my gravy spoon darling. What an easy thing to remember. Toss referring to those strap muscles down here, thyrohyoid, omohyoid, sternothyroid, and sternohyoid. That omohyoid is quite similar to digastric actually, where it has that first belly, a tendon in the middle, and that second belly. My gravy spoon darling, mylohyoid, geniohyoid, stylohyoid, digastric. There's a lot of hyoid. But these will be very important in terms of swallowing as well, as you move that hyoid bone to do that swallowing motion there. And you can see the attachments on the mandible are just inseparable from the jaw actions as well. I'm not the biggest fan of these pictures. I really should be, but I'm not. I don't like them. However, it is really quite nice to see how all these muscles interact on a face, like on an actual person. Because when you're going to be looking at the TMJ, you're going to be looking at a person, not what's underneath, I hope. That master there, big one. Sternocleidomastoid. There's that articulation, that capsule, zygomaticus muscles. And there's something on here that I want to talk about a bit later. But I won't get to it yet. Let's see if you can pick up what the odd one out is there. Before that, we have some vasculature. Remember, this place is highly, highly condensed with so much stuff going through there. When you're touching your jaw, when you're touching your face, when you're touching your neck, there's so much more than what you're touching. You're influencing everything. It's inseparable. That carotid artery right there, everyone's favorite, with that bifurcation where it splits into external and internal there, going into the circle Willis. Vertebral artery there, going through the transverse foramen and wrapping around that C2, C1 transverse processes. I think I knew about this one in primary school. We have the jugular vein right there. Everyone talks about it. And also we have a pterygoid plexus, or a lateral pterygoid plexus, which isn't shown on here, but there's a bunch of veins essentially there, which move their blood, quite interesting, through the movements of the pterygoid and through those master muscles. That's how they push the blood down and around. Viscera. No one talks about the viscera enough. What's this? You got it. It's a parotid gland. What's this? Submandibular gland. Teeth. They are sensory organs. I'll say that once and I'll say it again. The gums. I mean the nose, I guess. Sorry. And also that thyroid down here, and the thyroid cartilages, the trachea, the esophagus, all of these movements. You're moving the esophagus when you swallow, and that swallowing motion has muscles attached to the jaw. It's all related. And here's a nice picture with everything, even the nerves that I haven't shown, and the lymph. And I want you to reflect a bit on what those nerves might be. Vagus, phrenic, all of it. So like I said, you're never just touching one thing. You're influencing everything. If you want to work on the masseter, you're pressing on the parotid gland. They're going to start salivating inside. Same with the digastric, submandibular, sublingual on here, under here, not really shown yet. Here's a better picture of them as well, and the tongue, which is quite important as well for the TMJ function. And I also wanted to go a tiny bit into ENT. I apologize for the quality of these pictures, by the way. This one's especially bad. But just like the pterygoids, everyone loves talking about the eustachian tube right here. The connection between your ear and essentially your mouth. It can click. Sometimes that click is what you might hear and think is your TMJ. It's just the eustachian tube. And it's quite important in your sense of hearing balance, that congestion inside your face that you can't really pinpoint. It's one of those other things, along with the sinuses. If you know about sinuses, you love talking about sinuses. If you don't, you never bring them up. It's just one of those things. So make sure you know about your sinuses as well. Similar to the eustachian tube, congestion, infection of these sort of areas can refer to anywhere in the face, and yeah, you'll see it a lot more than you think you do. So that's it for the anatomy. I want to keep things quite short. Your homework, should you choose to do it, is to look at the attachments of the main muscles, the masseter, medial lateral pterygoid, temporalis, and if you're really feeling it, go for digastric as well. Nerve supply to those muscles, always important. Blood supply, venous drainage, and if you're really quite eager, have a look at the lymph. See if you can look at where the nodes may be, how you can locate them. That'd be quite useful as well. In the next video, we're going to be looking at the role of the TMJ, which is very osteopathic and very important, and it'll really get you get the ball rolling for where pathologies and things might start going wrong, what that might mean for the patient. So yeah, thank you for watching. Leave any comments, concerns, questions in the comments, because there's no way I can cover everything in one video, and I'm gonna have the link to the slides in each of these videos in the description of each of these videos if you want to go through them too. All right, all the best. See you.